Our next speaker hardly needs any introduction at all. A key member of the Kincardine medical community, patient advocate, capital campaign committee member, husband of Stacy, father of Matthew, and an aspiring rock star. Dr. Jason Murray does it all. Working in a challenged environment is hardly the easiest thing for a physician to do, but Dr. Murray and his colleagues have done their best to ensure that the emergency department at Kincardine has remained staffed and open this year. Jason is also a key fundraiser in the building healthcare for generations by creating the Rock with Your Docs, the annual concert, now in its 4th year, and being one of their top personal donors. Dr. Murray?
Thank you very much. Ladies and gentlemen, as mentioned, my name is Jason Murray, and I am a family physician and emergency physician here in this great town of Kincardine. Tonight I have the pleasure of speaking to you about the importance of the Kincardine Hospital redevelopment project from a frontline healthcare worker's perspective. While we watch neighboring hospitals face closures and reductions in services, I'm proud to report that the Kincardine Hospital is still going strong. Our emergency department is open 24/7. Our inpatient unit is one of the most efficient in the province. This is no accident, folks. This is due to the extreme dedication of your frontline doctors and nurses. We refuse to close. We work long hours and give up evenings and weekends with our loved ones to keep your hospital going. As mentioned previously, the last update to Kincardine Hospital happened in 1988. That's the year that I was born. While I still consider myself quite young, I'm a dinosaur when it comes to advances in medical diagnostics and treatment. I have very enjoyable conversations with Dr. Gary Gerben, who I believe is with us tonight. There he is, hiding in the back. He tells me of days when x-rays were developed on films in the basement of the hospital. He teaches me of the invention of aspirin, which made him feel like a real ER doctor because he finally had a treatment for heart attacks other than morphine and prayer. Nowadays, we have fancy clot-busting drugs and stents. We actually had a gentleman into the Kincardine ER the other night who had a heart attack. He came to the hospital with his wife, who had been stopped in a ride program en route. Thankfully, the cops let her go quickly. We had the clot buster into his arm within 12 minutes of arriving at the hospital. He was airlifted to London and subsequently had a stent placed in his right coronary artery. He waltzed into my office last Thursday with a big smile on his face and a box of Mill Creek chocolates for me, as if nothing had happened. Had our hospital been closed that night, he would not be here. This is why I do what I do. The installation of our CT scanner was monumental in Kincardine. Kincardine Hospital has for a long time faced reductions in services and loss of equipment and services to other sites, and I think it's been quite upsetting to its people. We're now on the path of building up our hospital to something to be proud of again. The CT scanner lets us see your insides in great detail. As alluded to in one of the previous patient stories, if you whack your noodle, we can do a CT scan of your head to see if you have bleeding into your brain. And if you do, we can fly your buns out of here faster than we can say hello and goodbye and get you down to a neurosurgeon for life-saving care. We can scan through your entire abdomen and pelvis to diagnose nondescript abdominal pain. If you come in with severe ripping and tearing chest pain, we can do a CT scan of your aorta to diagnose an aortic dissection, which is a tear of the largest blood vessel in your body. We happened to have one of these cases in Kincardine not too long ago. It was Easter Sunday, in fact. We were just sitting down to a nice Easter dinner, my family and I, and then I stroked her to the hospital to help assist in this gentleman's care. But it's really the CT that was the workhorse that day to save this gentleman's life. It diagnosed his aortic dissection, and we flew him out to London to receive a stent to his aorta, and he has lived to tell the tale. The MRI machine will be the next epic piece of medical technology to be installed in Kincardine. It will establish Kincardine as a medical diagnostic imaging center of excellence. The CT scan remains our workhorse in the emergency department, but an MRI scanner offers unique advantages. An MRI machine is required to accurately diagnose numerous problems in medicine, including being the imaging modality of choice for brain tumors. We can also use it in emergency situations to diagnose spinal cord compression and an entity called cauda equina syndrome, which is a neurosurgical emergency where you have pressure on the nerves in your low back. MRI scans are commonly used to diagnose knee injuries, such as ligament or meniscal tears. They can also be used in the screening and diagnosis of breast cancer. There is no doubt that having an MRI scanner here in Kincardine will shorten wait times, improve diagnostic accuracy, and it will be available on call 24/7 in case of one of the aforementioned emergencies. I often hear that Kincardine Hospital is only open because of Bruce Power. And whilst I adore Mike Renchek, James Skonjak, and Jim Peevers, I've yet to see them take a shift in our emergency department. However, as mentioned previously, the Kincardine Hospital and Bruce Power should be thought of as having a beautiful symbiotic relationship because we need them and they need us. They've been very generous donors to our campaign, as mentioned previously, 1.5 million from Bruce Power proper and 500,000 from its suppliers. So we owe it to them and to the Hawthorns, let's not forget about the Hawthorn family for their generous contribution, to have a state-of-the-art decontamination room for the workers at Bruce Power in case of a nuclear emergency. When not in use for Bruce Power patients, the decontamination room can also be used for other non-medical, medical patients and conditions. And we also hope to use that facility for simulation sessions. Trauma, cardiac arrest, burns, delivering babies, you name it, we can practice it in simulation and then be ready to perform under pressure. The current state of affairs in the Kincardine emergency room is that we have wonderful people working in a very tired facility. Ceiling tiles are falling out of the roof. Equipment is falling off of the wall. There are not enough electrical outlets in some of the rooms, especially the resuscitation rooms. So say we have a ventilator running and multiple IV pumps. We often have to precariously run extension cords from other electrical outlets to power numerous machines at once. These issues will all be solved with our new facility. The suction systems are unreliable in the current setup. Our current IV pumps can only run one drug at a time. So my personal favorite game is adult Tetris, where we have to stack 5 IV pumps on top of each other in the back of an ambulance while we transport patients to the ICU. The new emergency department will undoubtedly improve the quality of care provided to the patients of Kincardine. The expansion from 9 rooms to 13 rooms will lead to shorter wait times with less gridlock and improved privacy and confidentiality. Better equipment will make us frontline workers more comfortable performing our job because less jerry-rigging will be required. A new facility will boost the morale of the frontline doctors and nurses and make coming to work every day much more enjoyable. And perhaps most importantly, a new emergency room and MRI machine will help bolster our physician and nurse recruitment and retention efforts, which is so critical for our growing community. I thank you for your time and attention this evening. In closing, I'm going to put Councillor Mike Hinchberger on the spot. Sorry, Mike, I promise it's nothing derogatory. He said at a recent council meeting that the people of Kincardine are going to need to choose between things because there is only so much money in the budget to go around, and I couldn't agree more. What I say to that is choose healthcare. Without our health, we have nothing. Please give as generously as you can to our capital campaign. The time to act is now. I look forward to working alongside each and every one of you to make our hospital something truly special and something we can all be proud of. Thank you.
When we hear about the challenges our healthcare professionals and hospital staff face every day in treating the citizens of Kincardine area, it makes us grateful for their dedication. Don't you agree? Thank you, Dr. Murray, and to all your fellow healthcare workers on behalf of our community. There's one more video tribute that we wanted to include today. The community recently lost a local hero, Doug Kennedy, and his wife, Kathy Alkenbreck, wanted to share her thoughts on the importance of local health care.
In the late 2012-2013, my husband Doug Kennedy was diagnosed with a cancerous tumor, and he was quickly diagnosed by his family doctor, who immediately had him set up with a specialist in London. After 7 weeks of radiation and then surgery to have the tumor removed, our lives slowly came back to normal. Doug discussed how lucky he was to have a family doctor, because without a family doctor, who knows what would have happened with this diagnosis. When he ran for council in 2018, he wanted to find out how to recruit doctors and why there were so many people without doctors in this area. It was a challenge for him, one he was determined to try and fix for our surrounding community. We are fortunate enough to have a hospital in this small town of Kincardine, with our doctors working way too many hours just to keep our emergency department open. Now with a CAT scan in place and an MRI coming in the near future, patients will not have to travel out of town for special appointments. The Hospital Foundation and the Doctor Recruitment Committee are working very hard to help everyone in the area to have a doctor in place sooner than later. Please, it all takes time. Please be patient. A lot of the committees are volunteers. Please don't forget that. If you know anyone who has a young adult going through to be a doctor, please reach out to the recruitment committee. Please, everyone, let's work together in making the Kincardine Hospital the best in the area. Thank you.